Hi, this is Christy with Guidepost to Wellness. Welcome back to my return viewers, and welcome to anybody that's new to the channel. On this channel, we talk about anything and everything to do with autoimmune disorders, chronic disease, and the foundations of wellness, such as sleep, proper eating, movement and exercise, and especially stress management. I haven't posted anything in a while with the pandemic and everything that was going on, but I have recently had a medical situation that I thought I would share with the group. So why did I name this Out of My Right Mind? Because about 6 weeks ago I had a stroke on the right side of my brain. So I haven't been in my right mind since. So today I want to talk a little bit about lupus and stroke risk. It turns out that lupus and rheumatoid arthritis patients have a much higher than the general public risk of having a stroke, because the autoimmune disease increases systemic inflammation in the body. So I want to do a little bit of a disclaimer here. Don't be afraid to laugh. I'm not a stand-up comedian or anything like that, but I do use humor to kind of deal with things. And so some of the things that I'm going to talk about are going to be a little touchy and, embarrassing and maybe a little sarcastic. So don't be afraid to laugh. I'm okay if you laugh at me, if you laugh with me. Laughter is good medicine. I even did a video on that, talking about the health effects of laughter. So I'm all for it. Feel free. So talking a little bit about lupus, a little bit more about lupus and strokes. 20 to 30% of lupus patients actually die from strokes. The average age of a stroke patient with lupus is 34 years old. I thought that was just crazy. I can't imagine being 34 and having a stroke. I'm having a hard enough time at 51 believing I've had a stroke. So lupus is an autoimmune disorder, and it causes inflammation throughout the body. And inflammation is the root of all disease, basically. And what's also crazy is that the stroke risk increases every 3 years post-diagnosis for lupus patients. So it's been 27 years since I was diagnosed, so I'm 9 times higher risk of having a stroke right now than I was when I was at my sickest with lupus. Another factor that comes along with lupus is something called Anti-Phospholipid Syndrome. There's a primary form of it where you can have this and no other disease, or it can be a secondary form. So for example, 30 to 50% of lupus patients have Anti-Phospholipid Syndrome. And basically what that means is that your body makes antibodies that attack phospholipids. And this is critical because phospholipids form the outer wall of every cell in your body. So it's a double whammy if you have lupus and APS. And it turns out that if you have primary APS, 90% of those folks will later go on to be diagnosed with systemic lupus as well. So autoimmune disorders often come in groups whenever you have them. So what happens with having Anti-Phospholipid Syndrome is you've got inflammation throughout your body. Lupus inflames the blood vessel cells, and then the antibodies attach to the irritated cells and start to form clots. Then if you have any other factors, like taking bioidentical hormones or high cholesterol or anything like that, that can also increase your risk of clots. So some of you know that I've been taking bioidentical hormones, and the crazy thing is I thought my lupus was under control because I wasn't having any kidney issues or none of the big issues like I had before. But apparently it's still been lurking under the surface, insidious as it is, and I still had the inflammation because even with looking at the hormone replacement therapy, stroke risk can increase for women over 60, but it's extremely rare to increase the stroke risk for anyone less than 60. But when you take lupus plus anticardiolipins and you add in oral hormones, that equaled a stroke for me. So I have multiple doctors that kind of miss that connection, and I miss that connection. I even went to a rheumatologist the month before I had my stroke, and she didn't do any lab tests to check and see if my anticardiolipin levels were elevated, which would be a sign of lupus activity for me. But no point in, it's water over the waterfall, as I'll say. So going back to the day it happened, which happened to be Veterans Day, which I find ironic considering that I got the lupus while I was in the military, and then it comes back and smacks me upside the head again, literally, on Veterans Day, just as kind of a twisted reminder. But we were up in the mountains near Grandfather Mountain, an area called Wilson's Creek Watershed, and we were just enjoying the beautiful fall leaves. And an hour before I had the stroke, we were literally standing at the top of a hill, and it was a waterfall all the way down. Thank goodness I didn't have the stroke there for a variety of reasons. One, tumbling down a waterfall wouldn't have been very good. I'm sure that would have added insult to injury, of being paralyzed on my left side. It would have added a few broken bones and a few other issues, plus trying to get me out of there would have been even harder. That's why Greg was very happy, very thankful and grateful, as was I, that it happened while I was actually sitting right there in the car. So I wasn't at risk to fall and get hurt, and he didn't have to worry about trying to drag me out of the woods or anything like that and get me to medical help. So about 30 minutes before we had the stroke, I had the stroke, we were fishing and Greg was catching some brook trout and I was filming it. And we got done with that and I got in the car, and he noticed right away that in his mind, I wasn't acting quite right. And he said I was all hunched over and my face was kind of all scowly. And for whatever reason, he noticed that I wasn't moving my left arm, and he kept asking me to move it, and I couldn't move it. But I didn't realize that anything was really wrong because I didn't have any sharp pain or anything like that. I didn't have any visual problems. I didn't really notice until after I was talking to the second and third EMT that came with the ambulance, and they were asking me questions, and I could hear myself talking, and I could hear that I was slurring my words because I sounded like I had just gotten out of the dentist chair and had a mouthful of Novocaine. Felt like my tongue was 3 times too big for my mouth, and it was very obvious to me. That's when I started to realize, okay, something's not right here. I still didn't want to go in the helicopter at all. So I literally went, instead of the movie Planes, Trains, and Automobiles, I was car, ambulance, and helicopter. And when I got to the ER, it was kind of funny. I called my boss and told him that I wasn't going to be at work the next few days because I was in the ER, that I had had a stroke, and he used some pretty colorful language. He didn't believe me. And I told him, yeah, I had to be helicoptered from Grandfather Mountain to CMC. And I said, yeah, I had to one-up the buddy that I work with, Mike, who had 2 strokes 2 years ago. I said, yeah, I had to one-up Mike. I had to go by helicopter. And he just laughed. And he said, you sound all right to me, because I have a pretty sarcastic sense of humor. And I said, yeah, I'll keep you updated. So when I was in the helicopter and I was starting to get a little stressed out, you guys know that I'm big into mindfulness and deep breathing because that helps stimulate the vagus nerve and trigger the parasympathetic nervous system and calm down your heart rate and your blood pressure and everything like that. Because I was worried about Greg. I was worried about, how am I going to pay for this helicopter ride? When am I going to go back to work? I'm 51. I can't be having a stroke. Not me. I mean, I wasn't even worried about that I couldn't move my left side that much. I was just more worried about other things, which is what happens when you're not in the present moment. Because it really was kind of pretty seeing all the fall leaves through the helicopter window. But I had myself so calm and relaxed by the time I got to the ER that my blood pressure was actually too low. So go figure. You can have your blood pressure be too low. So that was a bit of a challenge. They ended up putting 3 IVs in me and giving me 3 different medications. And then I was transferred up to the neuro ICU, and thankfully that's where I ran into some just outstanding nurses. Sam was the day nurse and Lindsay was a night nurse, and then there was also Miles. Miles looked like he should have been a linebacker instead of a nurse. He was so strong that one time he went to pull me from the CT scan table, which was slick because they like to polish it with orange scented Pledge so that you could slide people very easily on it. Well, he tugged so hard on that sheet that I about flew across the room like a football. And I told him, I said, Miles, you don't know your own strength. But he was brand new nurse, but he was really good because the poor guy. I have all these IVs in me. I have alarms going off every few minutes. I've got somebody coming in every 2 hours to check my movement and everything like that. And then I was in a little bit of pain, so they gave me some pain medicine, and that made me throw up. So I literally grabbed the plastic lid that goes over your food for dinner, because I had eaten, I think, some mashed potatoes and a roll, and it immediately came right back up. And I literally threw up in the lid to the food. And Miles came in and he was great. He just wiped off my face and gave me a little puke bag and said, don't worry about it, it's okay. And the only time he got a little worried is when they had to put in another IV, and him being a new nurse, he didn't want to have to be the one to put in the IV, because I have good veins for blood, but not really for IVs. They brought in the IV A-team, as I called them, with the ultrasound and everything like that. So the only issue I had with the nurse was that was the pinching nurse, as I call her. And as a general nurse, she was fine, but I started, I guess, as the area may have swelled a little, I'm not sure, but I started to actually lose the ability to move my left arm and foot more, because when I was in the ICU at first, I could literally move my fingers on my left hand like that. Haven't been able to do that since. And so this nurse was trying to make sure, she was trying to see if I had a pain withdrawal movement. So she had these hard acrylic nails, and they have those sharp little edges on them. And so she was pinching the back of my left arm, or she'd pinch my toes, and I was yelling, stop it, why are you doing that? And she explained why she was doing it, and I told her, I said, I can appreciate all of that, but I can tell you right now, you're not going to get the response that you're looking for if you keep doing that, because it hurts. You got to realize I've got 3 IVs in me. I've got a blood pressure cuff that's going off every 15 minutes. I've got alarms going all over. Oh, and twice a day they just decide to come in and stick a needle in your gut to give you a heparin shot. Whoever designs that treatment protocol needs to be tied to a board and have needles stuck in his stomach. I had a bruise on the left side of my stomach until about 2 weeks ago. And I know the needles are tiny, I get that, but it's still a needle in your stomach. And then when they push the medicine in, it burns. And then, oh, they're also doing finger sticks because they're checking blood sugar levels and stuff like that. And I did have to have a couple insulin shots. So at this point, everything hurts and you just want to be left alone. So the last thing you want to do is to have somebody pinching you, trying to get you to move your arm and your foot. And I told her, I said, if you keep doing that, I can't guarantee that the right side, which is nice and strong, is not going to reach over and smack or kick you. And I thought to myself, well, what's the worst thing that they can do? Send me home? Give me an enema? give me an enema, that's just going to be, you know, just as difficult for them as it would be for me, so punish them too. So she did stop, and I'm glad, because it was already challenging enough being there and dealing with everything without having somebody pinching you, trying to make you move when you can't. And while I was there, I did have some therapy start. The first time I walked after the stroke, I couldn't walk more than about 5 steps without having to sit down and take a break. It was awful. And I had a great therapist tell me to make sure I was looking at my limbs and then talking to them, because the more ways I could engage the left side of my body, the better. And I've done a video and a blog article on how words have power and the power of positivity, and I realized, well, then I better quit calling my arm my dead fish and my broken wing and my cadaver leg, because those aren't real positive types of images. And so I named my left arm Missy, because then I can, come on Missy, you can do it, you can do it. And I named my left leg Skip, because just I'm sarcastic like that, because yeah, last thing I'm going to be doing anytime soon is skipping. That's how I knew that my doctor had a great sense of humor, because the first time I met Dr. Shao, he walked in and introduced himself to all 3 of us, and I thought that was pretty funny. I think Missy is kind of my sensitive side. I am a moon baby Cancer in July. I'm sure everybody knows my birthday because you have to say it all the time. And then I think Skip is my butt-kicking, hard-charging from the military side of me, because he's done really well. He's gotten a lot stronger, and Missy's still lagging a little bit. But I liken being here in rehab to being in boot camp, because sometimes the therapists are like drill sergeants. They just keep pushing you and pushing you. The first day I was doing my assessment, and I walked a little bit, and I thought, okay, well, that's good. I was pleased with that. And then she took me over to the stairs, and I'm like, hey, lady, did you not read my chart? I can't move my left side. How do you expect me to climb upstairs? Well, she knew I could do it. She just needed to convince me that I could do it. And that's what it's been like. It's just the constant, you know, moving out the goalpost a little bit and pushing. And then I'm a little bit of an overachiever anyway, so I have to keep pushing. Like today, I wanted to beat my last walking. Last week I walked over 400 feet without taking a break. That was the longest I had walked the whole time I'd been here. So I told her today that I wanted to do over 600. Well, I ended up doing 670 feet with a cane, and then I got another type of walker and did another 480 after that. You add that all up together, and it turns out I walked 1/5 of a mile. That's pretty outstanding. I mean, it's not, I was walking a mile a day before work before, but hey, compared to 5 steps, I'll take 1/5 of a mile any day. So I wouldn't have been able to do that without the constant encouragement and always pushing me to do more and showing me what I could do of the therapist. So I'm really thankful for that. And I definitely want to call out how great the doctors and the nurses are here. Everybody's just outstanding. I've had a couple of times when I just kind of had a mental meltdown, and they've been so supportive, and they're just, it's okay to have a bad day, you know, and then they just give you some encouraging words. And they celebrate everybody's victories, which is so wonderful here. When I first walked with a cane, a nurse came in that I hadn't seen in several weeks, and he walked in and he said, hey, I heard you're walking with a cane. Or they'll see you in gym and rehab, and they'll be like, hey, you're looking really good. I saw you moving your arm the other day in therapy. So they notice and they celebrate your victories with you and keep encouraging you and telling you that you're gonna get through this. And that's really important, because the brain needs love to heal too, and that's one of the things that I've really learned has been a silver lining, if I can say that. Not that you would ever think you'd find a silver lining of having a stroke. Well, with everything that's been going on in the media and the world, it's really easy to get a really dark picture of humankind and think that everybody hates everybody and everybody's mean and stressed out and fighting and looting and doing all kinds of stuff like that. And then you come to a facility like this where everybody loves their jobs and you just feel like you're in a cocoon of love and you're safe and you're supported. It's crazy. I actually was fine with them extending my time here twice. Most people would be like, no, I want to go home. And I do want to go home. But I also know that this is where I need to be to get stronger mentally and physically. Though I have to wonder what the hiring criteria are for hiring all these top-notch people. I mean, it is amazing to me. Some of these CNAs started being CNAs at 16, 17 years old. I think back of what I was like at that age. There is no way I would have had the compassion, the grace, the respect that these folks have of helping you clean up messes and everything else like that. They're just, I mean, they're just so, and they have such good teamwork. And, I mean, they work so hard. I mean, Michaela did 5 miles of walking up and down one day. And, you know, you almost feel bad when you press the call button to call them because you know that they're hustling and they're helping somebody else. And I always, just a little joke I make is I always tell them, I know I'm your favorite patient, but I know you have other patients, so it's okay. And I'll check the clock and make sure that I'm not calling them again too soon. And Greg's been real helpful when he's here. He'll help me so that they don't have to. But yeah, I have to wonder. I was laughing to myself because I like to watch the Animal Planet while I'm in here, and I was laughing to myself. Okay, so what did they do? Put a turtle in the middle of the driveway when candidates are coming for an interview to see if they stop the car and move the turtle to the side of the road? Did they put a little bird with a broken wing outside the door and see who stopped and picked it up and, you know, put it in a little box and try to help it? Because you just have to wonder how they got so many high quality people to work here that all just have such big hearts and so much love and compassion. It's just amazing. It just has really given me renewed faith in humanity, because I do know that there's a lot of love out there in the world, and this facility is full of it. So I will be doing some more topics on future videos, talking a little bit more specifically about physical therapy, talking about the transition going back home and outpatient therapy, eventual transition, not sure when, but to going back to work, all those different challenges. I'll be talking about some things that people probably don't want to talk about, like the challenges of having a stroke and feeling like you're a child again. It really is like a second childhood. It's crazy. Some people have to learn how to talk again. I didn't have that, but did have to learn how to walk again. And it's really hard to lose your independence, and everything is so hard now. I mean, I can't even roll over in the bed on my right side without feeling like I'm a beached whale or something like that, or flopping around like a cockroach on your back, just trying to flail around because your body's just not cooperating. And like being potty trained again, I mean, literally, because the thing is when you think you have to go to the bathroom, you should press the call button probably about 10 minutes before that point. So you are just like a child trying to read those cues and learn your body again. So yeah, we'll talk a little bit more about that. And if there's any topics that any of you would like to hear about, please feel free to put them in the comments below. I'd love to hear other people's stories and any topics that you want to talk about. Otherwise, I'm going to be talking about some of the different medications that I'm on. I definitely am going to talk about the cholesterol busting foods that I'm going to be eating, because there's a lot of natural things that you can do, holistic things that you can do to help improve your cholesterol. And I've already started doing that. I eat my oatmeal with dried fruit on it almost every morning. And when I get home, I'm going to switch back to doing my overnight oats with chia seeds. And there's a few other foods that are really good for cholesterol busting, because I want to get off Lipitor as soon as I can. I want to get off as many medications as I can. I know I'll be on a blood thinner probably for the rest of my life, I get that, but I'm also going to have to figure out, part of that is because I learned a really scary statistic in stroke education class they did here, that 25 to 40% of patients go on to have a second stroke within 5 years. And I told my husband, no, I'm not coming back here except to visit outpatient therapy. I'm not going to be back in here for rehab. I'm not going to have another stroke. And he said, so what are you going to do about it? I said, well, I'm going to have to get back to the fundamentals and health coach myself again. I'm going to have to figure out something to do for sleep, since I can't take the hormones anymore that stop the night sweats and everything. So I'll have to look at some natural alternatives for that. I've got to get back into, as soon as I can get down, up and down off the floor easily, I've got to get back into doing yoga and doing all the strength training exercises that I've learned here. And part of the reason why I'm pushing so far on endurance for walking is I was walking a mile a day before work, and trying to walk a mile or so at least at work, and go outside and walk some laps and get some sunshine. So I want to be able to start doing that as soon as I can as well. And then stress management, because I'm putting physical stress on my body trying to make it stronger, but there's also just the emotional stress. I've got thousands of dollars of medical bills to pay. When am I going to go back to work? When am I going to be able to drive again? When am I going to have my life back? Because the thing is I need all 4 limbs to do some of the things that I enjoy the most, like floating down the river. I need to be able to use both feet, because we wear fins on our feet, so we can kind of move around like a duck. And then I need to have both arms working so that I can row when I'm in straight stretches of water. Because for Christmas we just got ourselves some new pontoons so that we can carry more weight and put camping gear on the boats and do an overnight float trip down either the New River or the Tuckasegee. And we were really, really, really looking forward to that. And I don't want to put a damper on that. I want to continue to do that because I enjoy doing it. And it's going to be really hard to catch fish with just one arm. So I need to get myself back to 100%, and I'm going to work hard on doing that, and I'm going to share that journey with all of you. So again, thank you to everybody at Carolina's Medical Center and Carolina's Rehab Center in Mount Holly. You guys are the best. I will never forget you guys and what you've done for me and helping me get my life back. It's a small token of my gratitude, but this video is dedicated to you guys. I appreciate y'all. Thank you so much. Take care, everybody. Be well.